Hi, I'm Dr. Nichelle at Live Loud Chiropractic, and we want to give you an idea of what to expect for your infant pediatric chiropractic session. So we have a what to expect, a general video, and then here's what a treatment may look like for you. So little one here is getting a little sleepy, which is great when that happens. So first what we do is once we take them after we've done our history and our observations is we're going to take baby and check out range of motion in our arms, check out flexion, extension of their body. We're just looking for overall tension. So I'm going from side to side. So I'm noticing a little bit of restriction to his left side here. And we'll point those things out to you, what we're noticing as we go along. And then at the end of the session, we'll do a little summary of all the things that we've noticed. So I'm checking out rotation as well. And then we're going to come down onto the table. And this is just a shortened version just to give you a little bit of an idea of what to look for. I'm going to check out neck range of motion. So I'm going to check out lateral flexion, see if there's any restrictions. And a lot of times if I'm doing something and baby suddenly gives me a cry or a grunt, that gives me an idea that might be an area that doesn't feel the best for them. As we're doing our treatments, we take breaks as needed. If baby is really uncomfortable, they might need a few more breaks with their mom or their dad. I'm checking out here, range of motion of neck, and now I'm checking out how his occiput is moving on his upper cervical spine, which is an area that commonly has restrictions, especially in a vaginal birth, but it commonly has restrictions just based off of positions in utero. So I'll come in here and if I feel a restriction, I'm going to correct that. So I'm going to do the chiropractic work in this stance now. So I'm working on the upper cervical here, and this is all light pressure. So as you can tell, baby is literally sleeping right now. So this is all light pressure, very comfortable for baby. If we notice baby does make a noise and it seems like it's a little uncomfortable, it gives us an idea that there's probably a restriction in that area that we want to correct. So right now I'm working on that upper cervical, getting movement in that area that it's locked up a little bit. Same thing with that occiput. And if baby is restricted in an area, that's the area that we're going to sit on and do more work. I'm going to also check out arm movement, opening up these arms, seeing if there's any restrictions here, because we're looking at full body. We're not just looking at one region. We want to get movement where there's not any movement. We want to make sure that everything is equal. So if we see an asymmetry, we want to create symmetry in the body. I'm going to check out his pelvis here, see how that's moving, and I'm going to work on his pelvis. So underneath, you can kind of see I'm doing different pressures on the pelvis and then even along the spine here. I'll be doing different movements and pressures to get that symmetry of the body, get movement where things are not moving. I'm going to demonstrate a little bit of what I can do with him on his belly. Same thing, I might work on the pelvis in the position here. It's like, I'm sleeping, why'd you put me on my belly? It's okay, buddy. If I find a restriction in the spine here, I'm just going to do a little pump. Same thing, I might check out arm range of motion in this position as well. All right, you're okay. Hey, hey, you're okay. You're okay. You're okay. So we're doing a combination as the baby's in our arms of assessing if there's a restriction and a lot of times correcting that restriction as we're at that region. So I was assessing his neck and then I just worked on his neck directly right after that, as opposed to going back and forth. Now we do a lot of cranial work as well at Live Loud. So I'm just gonna be checking all of these sutures and all these bones and seeing how their movement is, restoring any movement where there might be restrictions. So right now I'm on what's called the sphenoid bone. I'm gonna come up and check all the suture lines, which especially after birth, we wanna check and just see how those are doing. And be working on just restoring movement between those sutures. All gentle, soft movements. Once we've done all of the assessment, if is there a restriction, is there tension, working on that restriction with our chiropractic adjustment, which you can see is very different because I've already done a few on Vander here, on a baby than it is on an adult. So with a baby, it's all gentle pressures and touch, sustain holds. There is not anything of the popping or cracking that you hear and you might have had as an adult adjustment or you might have heard about from somebody else. So you can see Vander has essentially slept through this entire thing. So it's very gentle work that we do. So cranial work. And at the very end, just because for some babies it can irritate them, especially if they're ready to nurse, we'll put on a glove and we'll do an oral assessment to not only check his palate, which is part of his cranium, but to also check his suckle. Because he's sleeping, I'm just going to kind of demo it here that my finger will go in the mouth, check the palate. And then if he does become alert, I would check the function of the tongue, check how it moves from side to side. Does it cut my finger? So as you can see at Live Loud Chiropractic, our pediatric, especially with infant, is very gentle chiropractic adjustments. We do cranial work. We're checking out to see if there's any restrictions in the body and removing those restrictions. And at the very end, we'll give you any home care that you can do. But we just wanted to give you a little bit of an idea as to what to expect for your infant pediatric session here with us at Live Loud.